Let's talk about caring for your dental implants after surgery. A huge misconception that I see a lot is people think they don't need to brush after dental implants, and that is false. If anything, it's far more important to brush following the placement of dental implants. For the first week after surgery, I always instruct my patients to use a small piece of gauze and to gently dab the gum tissue around where the dental implant was placed. If you do have adjacent teeth next to the dental implant, use a soft bristle toothbrush to carefully clean away any debris, making sure not to be too rough around the surgical site. I actually do not want patients rinsing with salt water during the first 2 weeks. Following all of my major surgeries, my patients actually go home with a Stella Life post-surgery kit, which is specifically designed for these types of situations. A lot of over-the-counter mouth rinses contain a high quantity of alcohol, which can harm your dental implant. Right after surgery, it's important to remember no forceful spitting, no vigorous swishing in the mouth. Try to be as gentle as possible. The tissues in the mouth are going to be traumatized from the surgery, and you want to be as careful as possible with all of the surgical sites. So, during the first 2 weeks following surgery, just use a small, sterile gauze to gently dab the area to get any loose debris that may be lingering around. Following 2 weeks, I always instruct my patients to use a baby toothbrush because it has the softest bristles, and to gently massage the surgical sites. Do not be alarmed if you see a little bit of blood. This is to be expected, especially for the first portion of your healing. Some patients worry because they are not able to floss following dental implant placement. It's vital to not floss this area because it can pull and tug on the implant, which can also lead to failure and the implant eventually falling out. Additionally, water picks are out of the question. Do not use water picks with dental implants unless the dental implant has had sufficient time to fuse to the bone. This process, called osseointegration, takes a minimum of 6 months. Do not use any toothpicks or metal instruments to help you clean these areas. It's important that your dental provider give you specific instructions on how to properly clean and care for your dental implants. Many times we will do full mouth extractions, put a number of implants in, and allow the patient to wear a 3D printed set of dentures during the healing process. This set of dentures is strictly for your healing. 3D printed dentures are not meant for long-term wear. Outside of not only protecting the dental implants, they will help you to learn to function and chew with dentures. Additionally, temporary liners will be placed to maintain the optimum fit of the appliance. After 4 to 5 months of healing, we will start taking the necessary steps to utilize the implants, and it will be your first time to experience actually having your teeth attached to the implants, which is truly life-changing. One thing that can happen if you don't care for your dental implants properly is something called